All right, why don't we go ahead and get started? My name is Julie Bershadsky. I am the Director of Community Living and Employment Focus Area at the Institute Community Integration here at U of M. Welcome to our second Reborn Policy Forum. Today's forum will be on the topic of our most recent July issue of the Policy Research Brief, and it's on the topic of the relationship between wage augmentation, pay increases, and quality of work life. Before we sort of get started, a couple of housekeeping notes. This session will be recorded. It's being recorded now, so please let us know if for some reason you're not comfortable with that. I cannot see the chat. Amy, can you let me know if there's anything that comes up in the chat that we want to address right away, please? Right, let's get started. We have 3 discussants on the topic today. Quinn Oteman is a first-year PhD student studying social work at the University of Minnesota. Quinn also currently works as a graduate research assistant at ICI and was last year's Minnesota Lund Fellow. Quinn started working as a direct support professional by providing early intervention services to children with a diagnosis of autism spectrum disorder. Quinn is dedicated to supporting individuals with intellectual and developmental disabilities live meaningful lives. Joseph Macbeth is the CEO of the National Alliance for Direct Support Professionals, NADSP, and the first employee hired by the organization back in 2011. He has worked in the field of IDD for 38 years, almost as long as I am old, beginning as a direct support professional. In addition to co-authoring several publications regarding workforce issues and sitting on nonprofit boards, Joe was appointed by New York Governor Andrew Cuomo as a member of the Advisory Council for the New York State Justice Center for the Protection of People with Special Needs back in 2016. Last year, he was appointed to the editorial board for Exceptional Parent magazine, and most recently, he was added as an honoree for the 20th Anniversary Historic Recognition Project, sponsored by AIDD. He lives in Vermont. And then finally, last but not least, is Ramu Iyer. He's an employment consultant for PROVAIL in Seattle and a member of the NADSP Advisory Council. He is a graduate of the Virtual Leadership Institute for Developmental Disabilities. Ramu's mission is to assist persons with disabilities to enable their full participation in competitive, integrated employment and community life. As a job developer, Ramu works with employers to customize jobs that align with the participants' desires, needs, and abilities, DNA. He is learning how to use a solution-focused approach to listen, build hope, and shape an individual's preferred future in a culture of inclusion. He has previously worked at Microsoft, Ernst & Young, Point B, as well as telecom and biotech companies. And on a personal note, I think we're very lucky to have Ramu Iyer in this discussion. So with that introduction, Quinn, on to you. Tell us about the topic, the brief, and how you got onto it.
Yeah, thanks, Julie, and thanks, Ramu and Joe, for being here, and everybody else too. This is going to be a great discussion today. So this brief, like Julie said, is about the direct support workforce in COVID-19 and quality of work life related to wage augmentation. So this idea sort of was sparked my attention from the last session that we had, and we were talking about incentive to become professionalized and the idea of wage augmentation and quality of work life sort of came to my mind. And I thought, well, that would be a really great topic for the next brief. So I actually reached out to a few people at ICI, and they were able to pull some of that data that wasn't included in the original publication. I wanted to highlight that here in this brief today. So here in front of you, you can see the full brief. And like Julie mentioned, we had kind of broken it down into smaller sections so we can talk about them in a little bit more depth. So you can go right ahead, Julie. Next one. Perfect. So The first section on your far left, the research issue, just to reinstate that, it is about quality of work life and wage increases for the DSP workforce during COVID-19. So in most direct service industries, essential workers have received wage increases or other benefits due to the pandemic. However, our study has shown that DSPs had a worsening quality of life for the pandemic overall, and providing wage increases showed to slightly improve their self-reported quality of life. So then on the far right, we have our study background, and what this and how the study came to be was it is a brief that resulted from a partnership between the National Alliance for the Direct Support Professionals and the University of Minnesota Institute on Community Integration. And this gathered information from DSPs from across the country. In this survey, ICI wanted to hear directly from DSPs regarding their experiences in supporting individuals with intellectual and developmental disabilities during the pandemic. So the initial survey was launched in April of 2020, and a 6-month follow-up survey was launched again in November of 2020. And the data that is in this brief you'll see today is from that 6-month follow-up survey. You can go ahead and run to the next one. Thank you. So getting into the key findings, the first piece of information that I felt the need to highlight was the responses from all DSPs. So this is showing us that that quality of work life for the direct support professional workforce since the pandemic was just overall worse or much worse. As you can see, 54% responded that way. That's more than half. And then it kind of regresses from there as getting better. So 38% said, oh, it was about the same since the pandemic started, not a whole ton changed. And then actually 8% of that sample reported better or much better since the pandemic started. So although that last bit of information is pretty small, we had all felt that it was pretty shocking that some had still said that, oh, my quality of work life was better or much better. And there could be varying reasons for that, which we'll get into a little bit later. Did you want to add something, Julie?
Nope, go ahead.
Okay, perfect. You can move on to the next point then. Thanks, perfect. And then the second key finding out of the three is actually showing us that the quality of work-life status was related to wage increases in some way. So to highlight that data and be more concrete about it, the very top point there with the arrow pointing down, it says 59% of those DSPs who did not get a wage increase reported their work life had gotten worse or much worse since the start of the pandemic. And then 50% felt that their quality of work life had gotten worse or much worse, even though they did get a wage increase. So to supplement those data points, there's a quote below that also says, they have increased our wages and I hope we continue to receive raises because we all deserve it. And this quote is from a DSP as a part of that survey. So we kind of felt that this data point was important because it tells us that the wages for DSPs were already so low that they're really, that these temporary wage increases didn't make a huge difference in increasing their quality of work life. And I'll let Joe and Ramu talk more about that in a second. So you can move on to the next one. Okay, and the third key finding that we felt was important was to highlight that, it's to highlight a question directly from the survey. And we had asked DSPs what they felt would be the most important thing their employer could have done to support them during the pandemic. So on the left, it says 16% there. So what that's showing is 16% of DSPs reported that increased pay was the most important thing that their organization could have done to support them during the pandemic. And that 9% is actually showing us that their organization did virtually nothing to support them during the pandemic. So nothing had changed at all. And that quote down below says, we did receive 2 bonus checks of $500 each during this pandemic, but with added expenses of providing our own masks and other supplies, increased gas for more shifts needing covered, and having no employee support system for therapy, the money did not go nearly as far as we needed it to. So that quote really highlights the fact that although these temporary wage increases did help some temporarily, it sort of highlights that second data point about why 50% still said my quality of work life was still worse or much worse since the start of the pandemic. Okay, thanks. You can move on to the next slide. Thank you. So all in all, this data really is pointing out that DSPs are providing essential services during the COVID-19 pandemic. And more than half of DSPs reported their work life was worsened during the pandemic. So we came up with 4 policy recommendations to potentially fix this issue. So the first bullet point to your left, it says that we need to design policies to permanently increase DSP wages to reflect their services that they're providing. So this recommendation could really help retention in the workforce, because we know that retention is high turnover in this workforce, and that was highlighted in the last brief as well. The second one down says that we need to officially recognize the DSP workforce as essential workers. So this will grant them access to childcare and other financial benefits that other frontline workers who were identified as essential workers during the pandemic were already receiving. The bullet point on the far right on top, it says that we need to professionalize the DSP workforce with advanced education and training to maintain their skills and potentially build up upon them. This point is really near and dear to me personally, because I have always wanted to further my skills as a DSP, but the organization I worked for at the time said, that's fine, but you need to take off of work on your already low paying job, and we're not gonna pay you to go. We're not gonna give you PTO to do this training. So like all my incentives personally went out the window for any professionalization. So DSPs need to be able to obtain this without penalty from their current situation. And then the last bullet point says that we need to establish a DSP standard occupational classification. So they're inaccurately classified currently in labor reports under other positions that might or might not fit their exact skill set. And because their work is so diverse and includes so much, this classification would really create a more concrete understanding of what their roles are and what their contributions are. So these are our policy recommendations, and I believe you can move on to the next one, Julie.
I think the next ones are actually group discussion questions. So I think we wanted to pull in Joe and Ramu now and get their perspective on some of the data points in here.
Yeah, it sounds great. So let's go back up to the data point 1. And
sorry, Quinn, before we move on to that, Amy, can I just check with you if there's anything in the chat right now that any questions came in that we should address right now before we move on?
Nope, I have nothing in the chat.
Excellent, thank you.
Thank you so much. So we have a couple of questions for both Joe and Ramu. The first one is for both of you, Joe and Ramu. You can decide who goes first. From your perspective, why might 54% of DSPs have felt that their overall quality of work life was negatively affected? What are your thoughts on that?
And I'll defer to my friend and colleague, Ramu. Go ahead.
Oh, thanks, Joe. Actually, thanks for the opportunity to share my viewpoints in this forum. So I'm actually at the bottom of the pyramid because I'm just, pounding the pavement, supporting the people in my caseload. So I'll give you my frame of reference, from that point of view. So I feel that many of the DSPs are experiencing stress due to the need to stay productive and billable. And even though, many of the participants in my caseload were originally laid off during the pandemic, and the pace of job development was very slow. So in other words, I had to figure out what to do to stay busy because the the amount of work, that had to be done was so little. In other words, I had to be very creative. And then there was unclear boundaries between work and life, since the concept of work had migrated home. And also, I tend to be a kind of more wired, and I was spending a lot of time in my computer, and I felt like I was working more hours, at home rather than separating work and life if I were to go to the office or be on the road. So in that sense, I felt that the quality of life was negatively affected because the time frame was so jaded. Going from one day to another, everything seems so static.
And thanks, Ramu, and thanks ICI for doing these. Not only doing these policy forums and writing the policy research briefs, but conducting these DSP surveys. This one was the second of 3. It was in the field. I think it was released in late November and open until early July. So it was really deep into the pandemic, prior to vaccines. And I'm not surprised by the 54% respondents saying that their work-life status has changed for the worse or much worse. There was so much uncertainty during those days. And I think the uncertainty of contracting COVID, giving it to friends and family that they live with from work, having to calculate the balance, is it worth it with the salary that I'm earning? I'm sorry to say it in those terms, but there is a calculation involved. But I also have to, put into context that during these days, a lot of traditional day services were closed. A lot of day service DSPs were reassigned. And when you're working in a setting in which you are unfamiliar, working with people who are unfamiliar, that's stressful work. I mean, direct support work is about relationship. And when you're working with people who you were assigned to, let's face it, you're in crisis. We are in crisis, all hands on deck. We're going to dispatch people because we need, and we are short-staffed. We lost a lot of people during COVID. And that adds a lot of stress and uncertainty in the work, working with people who you do not know, working with coworkers who you do not know. And, also, direct support work is often a team approach as well. So teams were under a lot of stress, working with a lot of new people coming in who did not have the luxury of good, sound orientation and training. And let's face it, if we're hiring people quickly during a crisis and getting people ready to work fast, people aren't prepared. You know what? Virtually no one is prepared to be a direct support professional on day one. It takes time, right, Ramu? It takes time to know people and get to know their preferences and what's important to them and things like that. So I'm not surprised by this 54%. In fact, I thought it might be higher.
Hi, my name is Linda. I'm from Department of Human Services, just sitting in because I work on our direct care workforce shortage. And I know I have a nephew who is a direct support professional in a residential setting and he's a student, a pre-med student on top of it. And he talked to me at great length about they had to wear at their provider agency, which is, I will say it's quite a large one. They would have to wear the same mask for weeks on end. I have to hang them up at the end of the day. Also, he said he hardly did anything social because he was so afraid of that he would spread COVID to his residents because they were very vulnerable people who might die if they got it. So I know that he talked about how hard a time this was for him in doing the work that he really enjoys doing. But during COVID, it made it much more difficult. I'm just kind of bringing it down to the ground to direct stories from, someone who works in the field, and that it was really horrific, and the amount they get paid is just really It's amazing. I think he gets like $13 an hour, and working 40 hours a week during pre-med school and another research job that might have ended. I think he didn't have that job at that time, but yeah, but I think he was pretty depressed, to be honest, with all the stuff going around. So I agree with you that I'm surprised this number's not way higher.
Yeah.
It's just to add to the conversation here a little bit, we're going to have the results of the third round of the survey coming out in about a month. And in that round, we asked a number of questions about the sort of the effect, the health effects, the mental health effects that the pandemic and doing this work during the pandemic has had on the DSPs. And Linda, what you're talking about in terms of the number of people who have told us, and even in the survey, that their depression levels, anxiety, fear, all of that is definitely coming through in the data as well. And it's difficult.
I think I was most shocked about the lack of PPE, that that management came in every day with new masks, right? And they asked, can we bring our own cloth masks in and wash them? They were told no. So, they're wearing these disposable masks for a week, 2 weeks, until they said it was so soiled. One of his colleagues actually got so ill from doing the mask that he got bronchitis. And his doctor said this is a result of utilizing the same mask over and over again. That's the conditions that are out there. And I'm talking, this is not a small provider either. So, it just really angered me that this kind of stuff was going on, and I'm sorry, I'm at DHS. I know waiver providers get reimbursed, and there's no way that they can say they can't afford PPE. I mean, for staff, I get PCA services. We didn't have I bought it for my stuff until we could get it. But even then, it's like, even to say you wouldn't let someone, and I got cloth masks, for our staff to use, but cloth's better in washing them than disposable and making them reuse them. I was appalled at that. So I think what might be out there might shock people to learn.
Yeah. Also, before the pandemic, right, we used to use the phrase work-life balance, even though that may or may not have been a reality depending on the socioeconomic status. Now, when we go through a pandemic, it is no longer life as usual. So we are in that transition phase during change. We know change is happening all the time, but this change was completely novel, and it was filled with ambiguity. And while we yearned for clarity, we also did not have a vaccine for a long time, right? So it was really a roller coaster. That was the meta context, while we had to figure out what was safe and what was unsafe, and many other factors. And that actually impacted our emotional bank accounts.
And last thing I just want to add to that, and thank you, Linda, for sharing that. I've heard similar stories. The information changes so quickly with this pandemic. What we know this week is different than what we knew last week. And it seems like every week there's more accurate information, new updated information. And that just creates a whole lot of confusion. They talk about the direct support workforce being on the front lines, and truly are on the front lines, supporting people who are more susceptible to contracting the virus, but also more likely to die from the virus. So I think DSPs needed to have a consistent source of good, solid information, but also clear and transparent communication with their employers. That's key. That was key during the early days of the pandemic, and I think it's key now.
Thank you so much for sharing all of these stories and perspectives. In response to Linda, I just want to say thank you. And I just want to say to everybody that the point of these briefs are definitely to engage the community and to inform the way that we present things and the way that we engage with the community. So this is really valuable to have everyone here and sharing those perspectives with us today. So kind of on a similar point, both Joe and Ramu, what are your thoughts about the 8% of respondents who felt their work life actually got better or much better since the start of the pandemic?
So when the pandemic, surfaced in the beginning, we transitioned, at least in my agency at PROVAIL, we transitioned to remote supports. So it was almost like, flipping a switch. So we followed the governor's mandate for the state of Washington. And when we transitioned to remote supports, it actually made job coaching more productive, especially for those participants whose jobs I was able to redefine so that they were able to work from home. Now, again, it's only for those participants who are digitally savvy and were able to easily use Zoom, and also they had a strong internet connection. There were others who preferred in-person support, and that required some delay because we were not in a position to go to their house. Also, my organization adapted to the transition by having an operating model for enabling us to work remotely and having policies in place to allow only a handful of people in the office to do any paperwork related to documentation, so that we could be socially distanced from one another. For me personally, working from home allowed me more think time and get more organized with my paperwork, because paperwork is also very important for the overall administration for the work we do. At the same time, I feel that the 8% is still an outlier, because the overall, for most people, the work-life balance was really on a holding pattern.
Yeah, I was going to say just that, Ramu. I'm actually surprised by that 8%, that their work-life status has improved. Some people, maybe 8% of the people, is just a guess, are at their personal best during a time of crisis. Some people may really be energized by, okay, it's a crisis, let's all chip in and work. And I suspect there's some people like that. But I also suspect that some DSPs are earning a lot of overtime and working more hours in a setting in which they're comfortable. They know their coworkers, and they may have opportunity because of vacancies and the challenges of finding and keeping new direct support professionals during a pandemic, that overtime may have been available. And sadly, most DSPs rely on overtime. And that's how they earn their living wage, either overtime or through a second job. So that's my guess. I think there have been, also, as Ramu has mentioned, there's been modifications made for DSPs to work more comfortably remotely. We figured that out. I think that's one thing that DSPs should take credit for. They are resourceful, and they were able to redefine their jobs virtually overnight, in settings that, one day we would be working in the community. I think I say this every time on a Zoom. One day we're working in the community in helping people in their jobs and helping people in their communities and supporting people with friends and families and doing the things in the community. Then the next day the community's closed and you have to figure out your job. DSPs did that. And some people, I think, were energized by that. That's a hunch. It's a hunch. No research behind that.
Thanks for sharing those perspectives on that. Yes, it is a very small number, but I think it's still very important to speak about. And I liked that you had brought up the idea of actually utilizing telemedicine and modifying their job. So like maybe for this example, again, more of a hunch, like you say, it could be that, oh, I enjoyed working from home more for reasons that, you know, we all enjoyed working from home more. And that could be contributing to that 8% as well. And so this last point is specifically for Ramu, and you kind of already spoke to this, but if you have anything else to add, please do. How has your coworkers' overall quality of work life been affected since the start of the pandemic?
Yeah, this has been for me personally, it has been somewhat productive, especially for the participants who have some flexibility to work from home. So it has reduced my drive time. So I'm able to support more participants because I'm able to work with them through Zoom. Also, on the flip side, since as a team, as a DSP team, since we are not meeting regularly in the office, I feel that the quality of interactions is not as great as meeting through Zoom, because I think it depends on the team. I feel like everybody is. Some of us tend to be transactional, and I'm not able to read the room, if you will, because the body language is also important to build trust. And maybe I'm old school, but it's something where, for me, it's an area where I'm concerned, because we have to be strong as a high performing team.
Yeah, absolutely. And I think something that you said there sort of made me think more about the relationships and how important that is for your job and the DSP profession.
Yeah, actually, there was one more point. So it's not just my team, right? With peer DSPs, but also the families we support. So in order to be very person-centered and make that intentional, it is important to meet with the participant and their circle of support, right, on a regular basis. And it happens best, as a collective in a space. I call it a barrier-free theater, and we can't replicate that in Zoom very easily, because not everybody is digitally savvy yet.
You are absolutely right on that. I know that I too and many others still struggle with technology, and we've been using it since pretty much day one. Thank you so much. We're going to move on to the second key finding. But before we do, I guess, Ramu or Joe, do you have anything else to add before we move on to the second one?
I'm good, Quinn.
Perfect. Okay, great. So for the second key finding, the first question that we have for both of you is, in your opinion, what does this finding tell you about the relationship between quality of work life and higher wages?
Yeah, I feel that, if I put myself in the shoes of a DSP, if I don't see a wage increase, or I see that the wage increase is razor thin, it means that the employer has not put a premium on the talents and the value delivered by the DSP. So that's point number one. It also means that management views people as hired hands. And I use the word hired hands specifically because this has been in vogue in management, whether it's non-profit or profit, for a long time, because very often companies downsize and they want to do more with less, and that's become it has become a cliche, and that's what causes employee burnout, and we continue to find challenges with that. We continue to see challenges that frontline workers in all industries, including human resources, see. So such an organizational culture does not enable me or another DSP bring my whole self to work. So that's inherently non-developmental, right? So if my management focuses only on my billable hours, then they're only looking at a number and not necessarily my whole person development, right? So that's an area that needs work. I'm not complaining, but I feel like that's an opportunity to change given COVID.
This is a complicated one, right? And I agree with what Lynn Megan just wrote. I think virtually every provider, every employer in this country would give their DSPs a living wage if they could. The fact is, the wages are set by state contracts with Medicaid, and we are held to the wage setting as it is. And it is not accurate in any state, and we'll get into that later, because we're basing wage rate methodologies based on inaccurate job classifications. This one, however, tells me a couple things, and it goes into one of the very first recommendation that Quinn went over, that DSPs need permanent wage increases. Temporary wage increases are good. They're not bad, and they're necessary. And the reality is, and I'm no longer a direct support professional, but when I was a direct support professional, if I got a bonus, it was spent quickly. And I was back where I started not long after I received that one-time bonus, because I had bills to pay, I was in debt, and I was struggling to stay afloat. And that's what we're seeing here. And the other thing that this tells me is that wages are important. Wages are the most important thing. If you surveyed any direct support professional, they will tell you wages, wages, wages. But it's not the only thing that leads to workplace satisfaction, right? There's other things that goes into being satisfied at work, which includes, which we don't talk enough about, workplace culture, which I think Ramu mentioned a little bit about that, the quality and effectiveness of frontline supervisors and their role in creating and developing high-performing direct support professionals. Are they prepared to do that job? Because that is a very challenging job. Most of the frontline supervisors that we hire are not prepared to do that job because there's no formal training for that job. And we promote people based on typically based on their direct support skills. You're a great direct support professional, you're probably going to get promoted. That does not mean you're going to be a great frontline supervisor. It's a completely different job. So this one is interesting to me. It's almost the same, 9 points difference, but whether you got a wage increase or you didn't, your work life has gotten worse or much worse. And that's why I think permanent wage increases is the key to the wage issue. That does not necessarily mean we're going to have DSPs who are satisfied with their work, because we have to look at employer business acumen, frontline supervisor skills, workplace culture, childcare, loan forgiveness. There's a lot of things in this big pool of opportunity that we have that goes beyond wages, but wages are number one, in my opinion.
Thanks so much, Joe. And thank you too, Ramu. Did Ramu have anything more to say about this before we move on?
So actually, all the criteria that need to be in place, it's almost like these are all the conditions that taken in aggregate would allow us to rationalize about wage increase. So all that is actually they fall under this category called job quality. So while we've had an excessive amount of attention, not only among DSPs, even in other industries, right? We focused on wage increase, but however, we have to look at job quality, because if we increase the job quality, then there is a career path for any individual. Otherwise, it becomes it doesn't become a meaningful job. And we can't use quality jobs as a buzzword, but rather become very intentional by looking at cost of living, benefits, and a career path.
Yeah, and I think on that, I
And
really,
that requires commitment from the top. And so it's not a superficial commitment, it is an intentional commitment.
absolutely. And it communicates to DSP workers that they're valued members of the organization when we really think about how their quality of work life is in the organization. And so like one way to communicate that to them is to permanently increase these wages. And that's just one way. There are so many other ways that DSPs can be communicated to that, hey, you are super valuable and we could not do it without you. I mean, it's a very hard job and there's so many duties. So just one last question for you, Ramu, before we move on to the third key finding for today is, in your own experience, do you know of any DSPs who have received wage increases during the pandemic? Was it helpful, and are people still receiving it?
Yeah, actually, within my organization, there was no wage increase because of the financial constraints, and basically, we wanted to just not have layoffs, and even promotions were postponed to delay a wage increase. So in other words, you could be doing good work, but you have to be on hold until things were more stable.
Thank you, Ramu.
Just to add to that, Quinn, before you go on, and even in our data as well, yes, we're seeing that the data are showing us that there is a slight improvement in the quality of work life if people got a wage increase. But even with that, the majority of DSPs did not get a wage increase, just like Ramu was saying. In fact, in our data, only about a third, even less than that, said that they got some sort of wage increase during this time. So another thing to point out.
97% identified themselves as primary wage earners in their household as well. So I had that too.
I don't think it was, okay, yep. I'm not sure it was quite 97% that were primary wage earners. I think 97% described themselves as essential workers. Yep. That was the data point that you're referring to. So yeah, even though people clearly know that they're essential, because of course they are, only fewer than a third of them said that they received some sort of wage increase, which clearly all too common.
So if I can expand a little bit, Quinn and Julie, and I think it's 67% from the first survey reported as head of household or primary wage earner. 97% said they were deemed themselves essential. But this notion of permanent wage increases is easier said than done. That would cost Medicaid millions and millions of dollars, permanent wage increases for direct support professionals. Every state right now is looking to create a plan to submit to CMS, the funder, of how they're going to spend a 10% increase in their federal match, FMAP. And this is a one-shot deal. This is not a 10% in perpetuity. This is a one-shot. Every state is going to come into a windfall of money, a pool of money, and you need to spend it within, I think, 2 years, maybe 3 years. But you're not going to get this money next year. You're going to get it this year. And states are struggling on how to affect some systemic change in the workforce with this money. And that's rightly so. They should be. Every state is looking at doing that. What you can't do with this money is pay permanent salary increases for direct support professionals because there's not enough money. So I think states need to be mindful about something that is sustainable for the workforce. CMS has to come forward with better rate setting models. And Jerry Smith wanted some more information about how the standard occupational classification can help. And there was a comment about, I think, rate setting, or rate setters are using direct support professional in their rate setting methodologies. It's not recognized by the Bureau of Labor Statistics in their database called ONET. one of the reasons why we have to fight for these one-time salary increases during the early days of COVID is because direct support professionals were anonymous to government. We all knew who they were, but government didn't really know who they were because we don't have that occupational title. We know who personal care attendants are. We know who home health aides are. We know who certified nursing assistants are. They pretty much all receive some sort of salary enhancements or bonuses without a lot of advocacy work. Since BLS does not recognize direct support professional, when we set rates through Medicaid in each state, we have to use a job classification that is recognized. So we use one of the three, PCA, HHA, CNA. And when you take a look at the requirements to do those three jobs and the job of a direct support professional, the direct support professional does significantly more health-related requirements, community-based living requirements, working with people without supervision in the community. And so when you're setting rates, you're setting them inaccurately because they're using a job that is not adequate to what the DSPs do. So rates are set low and they are manufactured low because we don't have that occupational classification. Just wanted to share that. And that's just in a nutshell. I can go on and on for hours about it, and I won't.
Thanks so much for that input. I really appreciate that, and for clarifying that data point too. Thank you.
Oh, yeah.
Let's move on to the third key finding of the day. So these next three questions will go to each of you, Joe and Ramu. The first one we want to ask is, why do you think there were employers who did nothing to support their DSPs during the pandemic? And why do you think people felt their employer did nothing for them?
Yeah, I'll probably speak about supported employment agencies in general, not necessarily just of one particular agency. But I feel that from what I saw, supported employment agencies had financial constraints and they were trying to stay afloat and avoid layoffs during the pandemic, because they know that hiring and training a DSP is expensive, and they wanted to make sure that they could at least save jobs, because there is a huge pipeline of participants who needed to be served, and there's also an existing set of participants that they were serving. And however, the only focus on cost control and ensuring programmatic funding caused them to be just narrowly focused on keeping the lights on and doors open. And then the everyday conversation remained focused only on submitting time cards or scheduling. So imagine if you're just doing just administration and nothing about talent development, right? So there was an absence of having a listening post to understanding what is a day in the life of a DSP during the pandemic, and that's important, and sharing stories. So in other words, you have to have a frontline manager, or even a supervisor, not a frontline manager, a supervisor, or even someone in upper management come down to earth and not just stay in their office. So some of them were out of touch and far removed from the DSP's struggles and pain points. And I feel like those are some of the factors that cause employers to be somewhat tone deaf to DSPs.
Well, this is a tough one. I think, when 30% of our responders, only 30% of our responders say that they received some sort of financial increase or remuneration. That is telling. I think a lot of it does have to say that our frontline workforce is not seen at the same level as other frontline workforces. When we have to advocate, say, wait about us, it's a pandemic, and we have people supporting people with disabilities, you don't forget about us. at a time in crisis, I think that's difficult to do. Again, I think why some DSPs feel like their employers did nothing. I would say that, that is about communication. And I think, employers really needed to communicate all the time, be transparent, let people know where we're at, what we're trying to do. Because I think if you have a workforce that is stretched to the limit, and the direct support workforce has been and is stretched to the limit, and doing that void of any type of communications from your employment or from your employers, it's a fail situation. So I know the vast majority of employers did something, whether your workforce knew it or not. That's the thing, right? I mean, that's communication, and that's good management, and that's good leadership. To be transparent and say, this is what we're trying to do. And that goes for right now with what we're trying to do with the FMAP spending. Are DSPs part of those conversations? Are they being brought in on what can we do with this money? Do you know how much money's coming into the state of Minnesota through FMAP increases for the next 2 years? What should we do with it? DSPs aren't part of those conversations. So how can we fix it for them without information from them? Sorry, I get a little angry sometimes.
Thank you. That is perfectly okay. We are here for that energy. Thank you.
Actually, I want to build on that. So when we look at supported employment agency, right, we look at it as just a building with walled offices. So we have designed an organization with silos, right? So then there is a power differential between management and DSPs. And then we have to look at the fidelity of communication. So it's not just enough saying that, oh yeah, we are following all the governors, all the CDC guidelines. Make sure you wear masks, social distancing, and hand washing. That is communication level 1, right? You have to get to the level 3 or level 4, where you're leading with the heart. So this is about leadership, right? You can't just lead with the head, but you have to lead with the heart, especially when you're in this human resources field. So that shift did not happen, at scale. It happened only in a few agencies, and I feel that is the opportunity we have to wrestle with, so that we use the pandemic as an opportunity to learn how to lead with the heart. Otherwise, we cannot bring the DSPs into the fold. Otherwise, it will remain a glass ceiling.
Thank you so much. And Ramu, I think you were kind of speaking to the second question here. I will ask it, but you may have already covered it, both Joe and Ramu. What are your thoughts and recommendations for employers who did nothing, very little, or felt like they couldn't do anything to support DSPs during the pandemic? Did you have anything more to add about that?
Yeah, I feel that we have to step back and understand what supports mean. So we should also think about the word supports, which is fairly dense. And you're right. So when we look at it from a person-centered point of view, it is not just supports for a participant or the person or who the DSP is serving. The quality of the interaction between the frontline, the supervisor and the DSP, the quality of the interaction between the someone who's at the senior management level and the DSP workforce management, supports for workforce management is also important, because only then they can actually provide genuine support, so that it becomes a person-centered culture, because culture has to become as important as delivering services.
Thank you.
Culture, organizational culture, as Ramu says, is really, really important, and including DSPs in creating that culture and having DSPs, giving DSPs the authority to make decisions. giving DSPs the authority to question what's going on, and building on that culture. The question, as you asked it, Quinn, what are my thoughts and recommendations to those employers who have done nothing or very little? I mean, my first thought is don't be surprised when you don't have direct support professionals coming to work for you. I think my recommendation is you have to look at your middle management and your communication, and how are all levels of the organization communicating with each other. I think most DSPs are very practical and reasonable people. And if they had the real information, I think they would understand it. But I also think that they need to be engaged, as I said earlier, with public policy. I think DSPs need to be more informed with how to make the change. Direct support professionals have been relying on others on these issues for probably more than 30 years. They've been relying on others to advocate for them. We have to do a better job. I mean, you look at the demographics. I know Julie knows the demographics and Quinn, of this workforce. It's a vast majority of our direct support professionals are women, and a majority of them are people of color. It's a social justice issue, and direct support professionals living in poverty is not new. They've always lived in poverty. So I think we need to engage DSPs better and get them more involved in their own cause. And then I think the employers will follow.
Thank you so much for that. Yes, Joe, I think that directly speaks to an issue that was highlighted in last month's brief too, that there's definite disparities and differences when it comes to race and being in the DSP workforce. Absolutely. So in interest of time, I want to ask this last question of both of you before we move on to the group discussion questions that we have prepared for you. The last one for both of you is, in your experiences, what have employers done well to support DSPs during the pandemic? And you might have already spoke to this, but what have they also not done so well?
Yeah, it's always good to celebrate what is already working well. Within my microcosm, I felt that there was sensitivity to the fact that everyone was facing health risks, especially when we were waiting for a vaccine. Within my agency, they gave extra paid sick days and also a paid day off for anyone who wanted to take some rest after taking the second dose of the vaccine.
Yeah, I think, there's best practices out there. There are some very satisfied, very, very recognized direct support professionals who are fortunate to work in organizations who respect them for what they do and appreciate their work, and on a regular basis, not just during a pandemic, right? I mean, I think DSPs should be recognized, outside of the pandemic. But I think what's been working in the last 18 months is giving DSPs flexibility, giving people or direct support professionals access to mental health supports and EAP. I mean, there's a lot of our workforces suffered trauma, the trauma that goes with working on the front lines of a pandemic, every bit as much as frontline emergency room doctors and nurses. So making sure that DSPs feel like they are appreciated, not even making feel that that doesn't sound right. Making sure that they are appreciated, not feel like appreciated, and being genuine about it, and celebrating them as often as you can. And you know what? Tired people, and we have a lot of very tired direct support professionals these days. Tired people will make mistakes. Tired people will make med errors. Tired people may say something that they otherwise wouldn't make, a comment that they otherwise wouldn't make. I think we need to be a little bit more lenient around the direct support professionals and the mistakes that they may make. And I'm not saying, overlooking serious med errors. That's not what I'm saying. but I'm saying that we need to make sure that we have some understanding of what our direct support professionals have been doing for the last 18 months. And that is showing up, rising to the occasion, recreating their jobs, and most of them not receiving any monetary reimbursement or increases at all. And, you know, we can call them heroes and these heroic people who, you know, do God's work. And, you know, that's not untrue. It may be true. I don't know. But if we're going to call them heroes, then we need to, on the other side of this, give them the respect that heroes deserve and give them a wage that they can live on.
Absolutely. Instead of just framing it as hero pay or just that temporary hero, just like check, like great job, thank you for sticking it out. Here's this one-time payment. Heroes and Shiros. Thank you, Connie.
Yes.
Go ahead.
Can I just say one thing about that? Because I read an article written by a man who has disabilities, and I'll find it and send it to you. It was in a magazine, and there's a man who received direct support services on a regular basis, and he took exception to his staff being called heroes because he feels that it's demeaning to people with disabilities. People with disabilities, according to this man, his name is Michael Irvin, do not need heroes to support them. By calling people who support me heroes devalues me as a person. I do not need a hero. What I need is a skilled, ethical professional to support me in my needs. So that changed the way I see this. I don't like those banners that says heroes work here, because you know what? People with disabilities, in my opinion, after reading that article, do not need heroes. They need skilled professionals.
Yeah, actually, I want to build on that. So, Joe, that's a great point. So it goes back to, you know, what is the definition of disability? So according to the World Health Organization, disability is not a trait inside a person, but it reflects the interactions between a person and their environment. And we can reinvent the job of a DSP to reduce the mismatch or find innovative ways to create on-ramps for a DSP, for a person with disability to find a way to be included and also enjoy all the good things in life. So it completely changes the narrative about helping or hero or just being transactional.
Thanks so much for expanding on that. I think that was a very important point to build upon too. And with that, I think we should transition into the large group discussion. So the first question that we'd like to just kind of open it up to everyone is, what can be recommended to policymakers to design a more sustainable, person-centered DSP profession? I'll give you a moment to think about it, but feel free to unmute yourself or put something in the chat. Don't be shy.
Hi, this is Lynn Megan. I think a fully, from the policy maker standpoint, a full appreciation of the DSP world and what people are doing. I think our bureaucracies are getting by easy in this process. They just say, you know, there's not enough money, there's not enough this, there's not enough that. I mean, you know, here in Minnesota, Linda's writing about it. So we have some grants that are happening, right? Which will be, it'll be good, but, you know, not everyone will get a grant to be able to help their DSPs. So it really is that full understanding. And I think from a national level, we've begun to do through Anchor and through work of a lot of other organizations, we're finally, DSPs, as has been talked about in this conversation, are being recognized, which is absolutely wonderful. We need to do that same at our state level, because I feel in many ways our bureaucracy, our Department of Human Services, gives us the word of mouth and doesn't take the next steps to really promote what we need to do. We talk about person-centered planning for people. Let's talk about it for DSPs as well.
I'll add to that. I think, listening to Joe talk a little bit earlier, the fact that DSPs are not incorporated into these planning discussions, into these conversations, it sounds like almost the first recommendation to policymakers would be to actually listen to and incorporate DSP voices in their deliberations and in their planning processes. Their thoughts on that.
Yeah, I feel that we should think about building a great organization, right? It's not just we should be constructively discontent about what exists today. So just having a good organization is not enough. So if you want to move from good to great, we want to focus on clock building and not clocking in and clocking out. Because right now, when I find a job for a participant, right, right now, I feel like I'm only being stymied by minimum wage jobs and the cost of the effort to find a door opener to just find a simple job, when actually the conversation needs to be more person-centered with an employer, and that requires more engagement, right? And that's not happening fast enough. So that's the reason we have the unemployment rate for persons with disabilities across America is pretty static at 30%. So I feel like there's a higher level of emphasis on cost control and business as usual. So that's causing an inertia and a mission drift. So I feel that going forward, policymakers should listen to the third year and recognize 3 points. The first point was what I made earlier, right? Adopt the definition of disability from the World Health Organization, where it is not a trait in a person, but rather it reflects the interaction between a person and an environment. The second, more importantly, is the quality of the interaction, right, is defined at the point of intersection between a DSP and a person with disability. So a DSP and a person with disability, right, they are joined at the hip. And we have to put a premium on lived experiences and the presumed competence of a person with disability. So that takes the concept of charity work out of the equation. And we should be more proactive about cultural renovation, because culture can never be perfect. Culture needs tender, loving care. So we have to become much more prescriptive about how we can create a more person-centered and a solution-focused culture. And instead of just analyzing what's wrong with something, because then we'll get into this paralysis mode. So this is a pivot, and it can be done, but it requires a coalition of the willing to make sure that we can become more focused on the change.
I just want to.
Oh, go ahead.
I'm sorry, I have to get going. I just want to clarify or give an update, like on Minnesota. Minnesota is taking our FMAP dollars. I think what you said, Joe, people can't give increase with those. And that's because they're, it's one-time dollars. It's not long-term. Minnesota is choosing to do an early in statute. Minnesota now has it's truly our getting to our own standard, our own definition of standard DSP. We have every 2 years, Minnesota has the opportunity to give an increase, and that increase would be coming in July of 2022. We're able to do it now in January of 22 with the increased FMAP dollars. So we're able to, and that increase will be, is required, again, by statute. It is encumbered that 80% of our 9% increase needs to go for direct support. So we've begun that start in Minnesota, and I think other states need to follow through with that as well, because, and again, it's a start for us. It's not near where it could or should be. We need to have way more than that 9% every 2 years.
Hi, this is Linda Walford again from Department of Human Services. And I want to say that there's been a lot of really good discussion here, and we struggle with many of these issues being at the Medicaid agency with, you know, number one, too little funds being allocated. But one of the things that I have learned in being a recipient of PCA care right now, but is that we need some commonalities among it, you know, not separating out people based on what type of disability they provide care for. For example, I like to use the word direct care professional, because DSP has come to mean people that provide services only for people with intellectual and developmental disabilities. And by separating that out does no one any good, right? Like, we're looking at workers that help people live their lives in the community as much as possible, that provide care for them, whatever, you know, in whatever setting that is in a community, including residences, obviously, that we refer to as group homes, typically residential settings. But anyway, I think one of the things that I most struggle with, this is as a person who employs people, and not employs people, but hires people, my own staff, and that it is great difficulty to do and to compete right now in the market out there, where, you know, if I'm selling hamburgers, right, I can raise the price of my hamburgers in order to give, you know, pass the increase on to people who want to consume hamburgers. But that's not the way that it works in reimbursement rates for direct care professionals. I'm going to say that, and we need to professionalize the job into something that people can earn a livable wage on. I think that's really important. B, that they get benefits, that they see that this is as a career and not just as a temporary job that they stay in for a little while. If that's what they choose. I mean, some people will go on, you know, to other even better paying jobs, but if this job paid enough, I know many staff who've moved on from me, not because they wanted to, but because they couldn't make a living at it. And until we professionalize this group of people and redirect some of the Medicaid dollars coming for their care to the people taking care of them versus pass through, where I know we've done some cost reporting, and over 50% of the dollars coming for their care is not going to the direct care. Way more is going to administrative overheads. And if you look at the Star Tribune and the top paid executives in the, you know, in Minnesota, you'll see a number of our disability service providers in the CEOs or, you know, head of the agencies in that top tier. And I think nothing makes us more angry as a person with a disability to see somebody's making this much money when my worker's making this much money, right? And I think that we're unique here, and that people with disabilities, and I do know Mike Irwin, I've met him, we share a same disability actually, is that this is what we're kind of a little bit tired of as people with it would never be acceptable for agencies of people with color run by white people, right? But why is it that in disability, we're the only group that's it's run largely by people without disabilities that feel like they're making money off of the backs of people with disabilities and the people who care for us, and they get the lowest wages of anyone in the companies. So I would think that we need a kind of complete overhaul of turning the system upside down, where the money actually, I think if taxpayers knew where their money went, it would be appalling to some people. And a lot of people, this is kind of a dirty little secret, I think, that people don't like to talk about and don't like to discuss, because I know I won't make friends by saying what I'm saying with some people out there, that there are large providers that make a lot of money off of us. And that's really infuriating when you see that you can't, we're the people getting paid so little money, and some people making a huge profit and pull in with, meetings with their, huge vehicles and go on vacations. And it's sort of a microcosm of our society right now, but the disability service system is sort of feeding into that versus really having the money go to where Medicaid directs it to go, and that is to the people that provide the care for us, but it doesn't go there. It largely goes to the people administration in those agencies. And I probably just made a bunch of people angry here, but I feel like I have to just speak what I've seen in a long time in this field at what's happening. And I don't see that getting a lot better unless we start to put mandates, as a person who spoke right before me, is that 9% increase came with a requirement that 90% be passed on to direct support workers directly versus admin costs, because for too long it's gone to lots of the money that we put into at least waiver services. I can't say the same about PCA. Their overhead costs are quite little in that, and that's what I'm talking about, the different systems, because there is a specified rate in the PCA program of what they have to pay staff. I believe it's 72.5% of money has to go directly to direct care workers. So I'm just throwing out ideas here that in the future, we might have to implement something like this with required mandates of what people have to be paid, because that's what money is supposed to be going for. And I think it's not necessarily going for that.
Thank you so much for all those comments. I mean, the engagement in these discussion questions is really what we are here for. Like, we're here to present this data, but these discussion questions and your thoughts are really important as we continue to talk about these issues. Julie, I'm wondering if we move on to the third question, since we sort of spoke to the second one quite a bit, we kind of led them together. So we've heard so much talk about wages and temporary pay increases, but how might we actually imagine the ways in which DSPs are compensated? What are your thoughts on that?
Yeah, I feel that organizations have to invest, keyword is invest, in upskilling by providing opportunities for learning and development, which includes earning a certification. So for example, when let's say I want to get a certification from APSI, right? Then I should not have to spend out of pocket, right? And I feel that learning and development is given an afterthought, and that hinders my ability to earn a certification so that I can become a professional. So personal growth is limited when the organization does not put a premium on upskilling, and it's vital to upskill, because only then I feel like I'm building a career.
I'd like to jump in on that if I might. I was going to add it to the last question that you had up there, Quinn, but it fits for this one too. Career ladders work. career lattices work. Keeping people in the jobs that they excel in and pay them according to their skill works. It works in other professions. We don't have it here because we rely on government funding and they can't pay for it. So I believe, and I imagine a way to pay DSPs differently is based on the level of their skill as determined by an objective third party and different levels of certification. That's what career ladders and career lattices are for. And that's why they're designed, because otherwise they're promoted out of the positions, as I mentioned before, they're promoted out of the positions that they're good at and putting them into completely different jobs. Makes no sense. And also keep in mind, we'll always have a percentage of direct support professionals who come here to do this job temporarily. They come here while they're going to school because we have flexible shifts and flexible locations. We'll always have that. It's always been seen as an entry-level job. It's an entry-level job that requires high level of skill. And by the way, there's also a high level of accountability when you make a mistake. So I really believe that we need to push policymakers to fund meaningful career ladder programs, certification programs for DSPs, and pay those who commit to this as a career substantially more. I could be wrong, but we should at least try it.
I'm wondering if others have thoughts on that, and if not, I do sort of want to go back to this question that we started talking about. There is this windfall of money coming into the states right now, right? With the 10% match, and states are trying to figure out how to use that money, which is easier said than done. I mean, on one hand, it's clear that we need more money, but then now with the limitations on how that money needs to be spent within the next 2-3 years, right? It's not permanent increases. Okay. So if we had, my question that I want to pose, if I had the opportunity to go to Minnesota and spend that money, allocate that money however I wanted to in the next 2 years, what is the best use of that money? Practically speaking, how do we, go with our backgrounds, our experiences, instead of saying, okay, well, this is not the best way to spend it, and this is not the best way to spend it, and this is not the best way to spend it. How would it be best spent then? And of course, it's a much more complicated issue. It will vary from state to state, from system to system, but thoughts on sort of some ideas on the investments that could be made with the most impact.
I'm going to give other people the opportunity to answer before I chime in.
This is Linda again, and I'm going to be working on these grants. So I'd love to hear your ideas, because there are definitely some parameters put around. And one of them is that 90% of the funding has to go to people who make no more than 200% of the federal poverty level. So right there, that, which is good in many respects, because that's people who need it. And for most DSPs will qualify for that. But how do we create that in not just giving them wage? And we don't even know if we can give money directly to individuals, right? Usually there's parameters around that. But before I came to this meeting, I was in a meeting where we started opening up the discussion of how are we going to do this. So.
Yeah, I feel that, we should look at the menu of person-centered supports that a person with disability needs, because supports is what is so vital in order to, and that's what a DSP is also providing in order to help, in order to enable the person live a good life. So that will include mental health, housing, behavioral health, even sometimes translation services.
So hopefully this FMAP money is just the start. I mean, if the Better Care, Better Jobs Act is passed, and they're talking about expanding home and community-based services significantly, and I've heard Amy Hewitt say this over and over again, you cannot expand HCBS without investing in workforce. They are intertwined. You have to do both. And I agree. I think there's a whole host of things that you can do. Tax credits. You can look at tuition forgiveness programs for DSPs. You can look at childcare programs, transportation programs. I really do believe that some sort of stipend with clear communication and transparency for those who have worked throughout the course of this pandemic, from day one until whenever, a stipend with the explanation that we wish it could be more, you're worth a lot more. This is a one-time deal because X, Y, and Z, FMAP is a one-shot deal. You won't get it again next year, but this is a thank you to you. That would go a long way. Absence of that communication and those explanations, you will breed resentment next year when they don't get it. So you have to make sure, and there's some states I know that are looking to do just that. And my advice to them is make sure that these people understand what's behind this money, where it comes from, and why it can't be available next year.
And I'll just add, this is Linda. We did it just quick math. And of the number of direct care workers taking into account PCA and waiver, we're looking at only if you took and divided that money up, that's 5 million, some that we have, that's like $25 a piece. That's all it would be. So we got to think that's what I'm saying. It might sound like a lot of money, but when you come down to it and do the math, now obviously not everyone's going to qualify, right, for that. So that par it down. But I mean, we just did quick math and going, this is how much that would be, right? Which is nothing, virtually nothing. So because I like the ideas that you threw out, they've all been thrown out that we've looked at, but obviously we're going to have to pick and choose because $25 is not going to, right? That's not going to reward or keep people in the field, but that's the reality here. So
it would actually be kind of insulting, Linda, right?
Absolutely.
Yeah. Thank you for that information.
But obviously not everyone is at the 200%, right? Poverty level. Workers, some of my workers, a number of them are there, a number of them aren't because they do this job because they care. I know them or have a relationship with them. But, I think by far the majority are going to be, people of color who are single parent and will meet that income guideline, right? So, but how do we distribute that even then if we could pare that down, right?
Yeah.
It's never easy. There's no easy answers.
And that's, I think, one of the reasons why we wanted to ask that question, to try to actually start thinking of solutions. So this is really good. This is a really good discussion. I do want to say that we are at time, just in case anybody wants to go, you're free to go. Thank you for joining us. Ramu and Joe, thank you so much for your expertise. We'll stay on and keep talking if others want to, if you're able to stay on and keep talking for a few minutes for additional discussion. But
well, Julie and Quinn and everybody, thank you for inviting me. I do have a 3:30 call. But these are fun, these are informative, these are energizing. So keep doing them. I love these policy brief discussions. So thank you.
Thank you so much for joining us again today.
Thank you.
Thank you, Julie and Quinn.
Thank you. All right, I think we will wrap it up. We will have another one of these in about a month on a related but different topic. So look out for an email, and this will be recorded and posted on our website. This was recorded, but it will be posted on our Policy Forum website as well, and we'll send that link around when it's available. Thank you all so much again. Thank you, Quinn.
Thanks, everybody.
Thank you.
Have a good rest of your day.